All right, nurses, let's talk about blood cultures. Advocate Maggie here, and this is a problem in our world of nursing. They oftentimes come back negative when they should be positive. Let me say that again. Due to the collection of the specimen, it's not collected appropriately, and so it comes back as negative when it should be positive, and then can lead to the patient developing sepsis and having a poor outcome, even expiring. Congress has met on this, was brought to my attention by this amazing nurse creator, Mick Hopkins. It's a problem. Insurance companies are getting involved because it's tied to money and patients having poor outcomes. We know it's one of the leading causes of death along there now with COVID up there, of course, coronary artery disease, cancer. So it's up there and people are looking at this. So this amazing nurse came up with an apparatus, again, just amazing. I keep saying this, Mick Hopkins, amazing, 25 patents, one of those being the blood culture collection. So you need to make sure that your organization is using evidence-based science products, that the policy is followed. If your organization is having this issue, making sure you're reaching out to people like Mick, making sure you're following the evidence, because the organization will be penalized. Congress has gotten involved. I don't think I need to say more about that, right? So making sure you're documenting all these things, how you collected the specimen, what was used, making sure that you're following the policy and what is evidence-based science right now. Because if the patient has a poor outcome and you were tied to the collection of it, and everyone who's drawn a blood culture knows, has been called about something related to a blood culture, people have been written up for. I can tell you that I have early on in my career with the blood culture collection. I don't think it's sometimes focused on enough, and we need to make sure that we're paying attention to that. So making sure you're following the policy, documenting how you're collecting it, sending it, and 2 different sites. If you're drawing it off a line, if that's not the standard of care where you're at, it needs to be 2 different sticks and or the first IV insertion, making sure you're following all of that evidence-based science and the policy, and following people like Mick Hopkins, who is the expert in this space, and possibly pushing for your organization to be looking at some of these products that do align with evidence-based science and decrease poor outcomes potentially when using these products in your environment. So let me know what you're seeing out there. Like, follow, and share. If you don't follow these nurse creators, innovators, let's do so and continue to highlight. If you want to be a nurse creator, innovator, you sure can. So like, follow, share. Love to see what you guys are seeing out there. If you've invented something, if you're a nurse creator, put that in the comments. Would love to know about it. And let me know what you're seeing out there, nurses. Document it, document it, document it. Not documented, not done. So make sure you document it.